Hi, I'm Rick Teska with Senior Market Solutions, your Medigap insurance advisor. In this video, I'm going to compare the Medicare Supplement Insurance Plan G versus the Medicare Supplement Insurance Plan N. You might have heard about them. They're the most popular Medigap plans right now. I'll start by explaining three primary similarities between Plan G and Plan N. Next, I'll highlight three significant differences between the two. Then I'll touch on premiums and state-specific exceptions. Finally, I'll describe two real-life examples to help you understand why some people are better off with Medigap Plan G and others are better off with Medigap Plan N. And hopefully this will shed a little light on the two most popular Medigap plans. Let's start with three primary similarities between Medicare Supplement Insurance Plans G and N. First, the Medicare Part A deductible is covered under both plans. Second, the Medicare Part B deductible of $185 per year is not covered under either plan. And third, both plans cover hospitalization, skilled nursing facility care, blood, hospice care, and foreign travel. For complete coverage information, click on the link in the description to access our Medigap plan comparison chart. Now let's talk about three significant differences between Medigap Plan G versus Medigap Plan N. First, doctor visit and outpatient copayments. Plan G has no copayments. Plan N has copayments of up to $20 per office visit. Second, let's talk about emergency room copayments. Plan G has no emergency room copayments. Plan N has a copayment of up to $50 per emergency room visit. However, this copayment is waived if you're admitted to the hospital. Third, Medicare Part B excess charges. Okay, you might be asking, what are Part B excess charges? Allow me to explain. Medicare has a fee schedule. Some doctors, based on their education and training, don't agree to the fee Medicare is willing to reimburse. These doctors are permitted to charge up to 15% more than the Medicare fee schedule permits. These are called excess charges. If no excess charges appear on the policy, the insured person must pay that additional 15%. While it's fairly uncommon, some individuals will run into this as an out-of-pocket expense. So moving back to the third significant difference between Medigap Plan G and N, the excess charges. Plan G covers the excess charges of up to 15%, where Plan N does not cover those excess charges. For a comprehensive breakdown of the differences between Plan G and Plan N, click on the link in the description to access our Medigap plan comparison chart. In most states, Medigap Plan G generally runs about $20 to $25 more per month than Medigap Plan N. The condition of your health may determine which plan is best for you. If you live in Wisconsin, Minnesota, or Massachusetts, you won't find the Medigap Plan G or Medigap Plan N on the menu. Each of these states has its own policy identification system, but fear not, we're developing new videos that focus on each of these states. Be sure to subscribe to the SMS YouTube channel so you don't miss a thing. So far, we've highlighted three primary similarities and three significant differences between Medigap Plan G versus Medigap Plan N. We've also talked about premiums and state-specific exceptions. Now let's see what this looks like in practice using two real-life examples. In example 1, Medigap Plan N is the better choice. Tom is a 74-year-old male. He lives a healthy lifestyle and doesn't take any medications. The only time Tom sees a doctor is when he goes for his annual physical. In this case, Plan N is a more cost-effective option for Tom. Here's why. Tom will pay a lower premium for Plan N. Tom will have to pay a co-payment for his annual physical and any visits to the emergency room. However, his annual out-of-pocket costs under Plan N will still be lower than the higher annual premium he's paid for the Plan G. If Tom selected Plan G, he would pay more money for the coverage that he doesn't need. So Tom's best option is Plan N. In example 2, Medigap Plan G turns out to be the better option. Linda is a 68-year-old woman who lives a sedentary life. She's a tobacco user who's slightly overweight and has high blood pressure. Linda's on several medications. She visits her doctor at least 4 times a year, if not more frequently. In this situation, Linda would benefit more from Plan G, and here's why. Linda will pay a higher premium for Plan G. However, Linda will not have to pay any co-payments for her doctor visits or any visits to the emergency room. Although Linda's annual premium is higher under Plan G, her total annual out-of-pocket costs will exceed that amount that she would save on the Plan N premium because of her frequent doctor and emergency room visits. If Linda selected Plan N, she would likely end up paying more than the annual Plan G premium when the deductible and co-payments are taken into account. So Linda's best option is Plan G. While these 2 examples are great for demonstration, I encourage you to look beyond generic charts and bottom line pricing. Finding the best plan to fit your needs and your budget is what we do here at Senior Market Solutions. Our licensed Medigap insurance advisors do all the legwork so you can focus on living your life. At SMS, we offer free Medigap consultations, and our services are 100% free to you. There's no obligation and no policy pushing. Our team is here to support you from Medicare enrollment through the life of your Medigap policy. Why not schedule your free consultation today? Either call us toll-free at 1-800-784-8969 or click on the link in the description to book your appointment online. Choose Senior Market Solutions and find success with SMS.